As a dentist, do you find yourself talking to patients and saying words that are really, really weird? Have you called a tooth a virgin to a 75-year-old on a random Tuesday morning? That sounds like you. My name is Paul, Dr. Nacho, and on this episode of How to Talk to Patients Like People, say this, don't say this, we're going to go over a number of words you can use to connect with patients, to motivate patients, to make dentistry more fun and way less weird. Let's start with the Q word. What is a good Q word to say to bond with patients? That word is question. So people ask you a lot of weird, a lot of strange, a lot of interesting questions. And the best way to respond is, that's a good question. I would want to know that too. What does my insurance cover? Does it cover all the crowns that I have to do? That's a good question. I would want to know that too. Will my implant hurt? That's a good question. I would want to know that too. Such a great phrase. Gives your brain a chance to think, shows you're on the side of the patient, makes them feel normal. The Q word, question. That's a good question. I would want to know that too. The R word. What is a good R word that you can say to bond with patients, to improve communication? And that word is regular. A lot of times we say the right way to do this is XYZ, and it's a bit judgmental. But regular just sounds like what most people do. So you may say, the regular way to do this is first we take care of all the foundational stuff, what we call periodontal disease, bone shrinkage, and then we rebuild your tooth. That's the regular way we do things. That's the regular way to do it. Regular sounds just a touch less judgmental than right. S word, one of my favorite S words is sharing. Instead of treatment planning, which is what you do dentist to dentist, what we do with patients in our operatory, dentist, assistants, team, is treatment sharing. So I often start off consultation visits by saying, I'd like to share with you some of the things we're thinking about for your teeth. I'd like to share with you a list of concerns and ways we can solve them. Sharing is a great word. It's a word we've all loved since kindergarten when we were taught to share. Sometimes it wasn't easy to learn that back then. My Mrs. Nacho is a kindergarten teacher. She knows how difficult that is. But we know that sharing is part of caring. So say to patients, I want to share this with you. Treatment sharing is one of my favorite things to do. Now, the T word. What is the T word that I like to say? Tip over. When do I use that? In the 9 magic words to millions of dollars. When a patient's missing a tooth and you want to share with them what happens if they do not replace it, what happens if they do nothing, tooth above it falls down, the bone in the area shrinks, other teeth break, and the tooth behind it tips over. Don't say mesial drift, say tips over. It creates a visual that patients will understand why it's a problem if the back tooth does not have a friend holding it up. Few more words to go through here. The U word. U is one of the best words to use. This U word is understand. We all want to understand the plan. We all want to get on the same page and understand what direction we are going in for your teeth. That can be the spouse, that can be clinically, that can be financially, but use that phrase. We all want to understand this plan. Should we include your spouse in the discussion? That's something a great patient communicator, Lincoln Harris, the founder of RIPE, he talks about that. Should we include your spouse in the discussion? I want us to all understand the clinical part, but also the financial part, how we're going to pay for it. So understand is a great word. V, value. How can you share with patients the value of what we do for them? One of my best tips is the 1,000 meals a year. So when someone has a crown in place for 12 years, and maybe it shatters, say you got great value out of that. It lasted 12 years. That's 12,000 meals. You can also talk about how other patients like the value of what you've done. I've done these snap in and out overdentures for years, and patients really like the value after they're done because they get to chew and smile with confidence. They're not worried about their dentures falling out at their granddaughter's recital. What's the value in that? So value is a great word to use. X and Z. The X is the X factor. The X factor is this. Hey, Mrs. Smith, the X factor in everything we do in your mouth, which is a high traffic zone. You eat 1,000 meals a year. You use it all the time. The X factor is timing. Timing is another word for luck. So it's just to share that some crowns, you may get 7,000 or 8,000 meals out of them. Some crowns, only 2 or 3,000. Some 15,000. The X factor is timing, which another word for timing is luck. We've all had cars, great comparison right here. We've all had cars. Some lasted for 8 years, some lasted for 15 years. How long something lasts depends on these three things. Golden Nacho tip right here. How well it was done. My team and I, Mrs. Smith, are going to do our best to do a great job for you. How well it's taken care of. I know you're going to take care of your teeth and what we do for you. And the third thing is luck. The X factor is timing luck. So use the X factor. And Z, what can we say for Z? Let's end on something super positive. So Z is what I like to use this word zero. When I see something that's really great for a patient on a level of zero, what do I mean by that? A lot of patients your age, Mr. Jones, have some bone loss or bone shrinkage. I see zero bone loss for you. That's awesome. You have zero cavities. You have zero wear. That's awesome. So use zero. When you see someone is doing something so great, they don't have any wear, they don't have any cavities, they don't have any periodontal, use that zero. Patients your age, a lot of people that I see would have 4 or 5 cavities by now. You have zero cavities. Be proud of that. So I hope QRS, TUV, W, X, Y, and Z, and we missed out on the W words. I'm going to fill that in as our final one, will help you. How to Talk to Patients Like People is sponsored by Dental Nacho Flicks, an anytime, anywhere resource that you can use to learn, earn CE, increase your success, and decrease stress. So the W word, which I've saved till the end, is one of the best ways, that's not the W word, ways to decrease stress when trying to get out of a hygiene exam or an appointment. So you want to seem likable because you are, you want to seem credible because you are, but you have other things going on in different rooms. So what you look at the patient and say, hey, Millie, what questions can I answer about fill in the blank? Not do you have any questions? The magic word here is what questions can I answer for you about your gum tissue? What questions can I answer for you about your treatment plan? It's a magic phrase because now the patient has to say, I don't have any questions, Paul. I'm good. Or they'll ask their question. So I hope you enjoyed How to Talk to Patients Like People. Don't say this, say this. Check out Dental Nacho Flicks and anytime, anywhere learning resource by texting Flicks, F-L-I-X, to 215-543-6454 or visit us at dentalnachos.com.